you want them to do?
You can take them with him if you want, or by the end of the day.
What we want to accomplish today is to give the public, our patients, our families, an opportunity to speak about what healthcare means to them and what their experience is.
Hospitals have been cutting nurses, programs and services, and closing beds for several years. They are unable by law to run a deficit budget, but funding hasn't kept up with inflation, so administrators look to the front lines, the RNs, to balance the bottom lines. The Ontario Nurses Association has been tracking these RN cuts provincially for about 8 months now, and over 1,600 RN positions are gone. I know this is a difficult economic time for many people, but when you realize that these nursing cuts amount to more than 3 million hours of nursing care for Ontarians, it's frightening. We all need to pay attention. These RN positions will never be reinstated. RN care, nursing care, has been lost forever in the communities throughout the province. The implications for patients of these cuts are very serious. For every patient added to an average nurse's workload, that patient's risk of suffering complications or even death rises by 7%.
I want to tell you a story of a couple I cared for a couple of years ago, because I can think of no better example of the work every primary nurse does at the centre does on a day-to-day basis. I had been the primary nurse for this gal for a number of years as she dealt with metastatic disease. She was always upbeat, never called, rarely wanted to talk about the fact her disease was progressing. But that was okay, as it got her through very tough times, and we both knew that at some point that discussion would need to be had. I picked up the phone and I called her husband, and I will never forget his first words. "Jill, I thought you gave up on us." A plan was put in place, and we saw them first thing in the morning. The next morning, it was confirmed that we had run out of options, and best supportive care was the plan. At the end of the visit, her husband asked to speak to me alone, and he began to cry. He had just been diagnosed with his own aggressive cancer, requiring surgery. He was so lost. He couldn't leave his wife alone to go to his pre-admit appointment for fear that she may fall. He would be having day surgery, but someone needed to be there with him that night, and there was only her. So I managed to pull a few strings within the facility, and I got him seen for his pre-admit appointment right in the cancer clinic. I called my friends at CCAC, and they immediately got somebody out to stay with that family. A very few weeks later, I was called into a clinic as he was in to see his surgeon, and he asked to see me. This was one day after he buried the love of his life. He said, "Jill, we took her outside last Sunday night and watched the beautiful Lake Huron sunset that she loved. She died in my arms through the night. You made that possible, and I don't know how to thank you." Sorry, I always get emotional when I talk about this situation. He asked me to stay with him when the surgeon came in to see him, and he lost his life a few months after this. Take my name out of this story, as it is what we as primary nurses do every day. We are specialized oncology nurses, highly skilled in recognizing the symptoms of emergent situations, strong advocates ensuring our patients, regardless of the eventual outcome, have access to care to preserve quality of life. We have a human connection to our patients that gives us the opportunity to respond to our gut feelings and really make a difference to those suffering with this terrible disease.
I'm telling you right now, when you're told by a doctor that you have invasive breast cancer, here's a card for a surgeon, have a nice day, don't worry about it. I'm telling you, you walk out of that office thinking you've been hit by a train. And then you go through surgery and you kind of go, okay, you know, they're taking care of me, they're taking care of me. Then you get to the oncology ward and you're met with your primary nurse, who is your lifesaver. She answers all of your questions. No matter how dumb you think they are, she'll answer every question you have. And a lot of these nurses have co-wrote little handbooks for you to take home with a wealth of information. You can call them, you get a cancer number, they give you your primary nurse. You can call anytime, they'll return your call. I don't know about you, but I have a 7-year-old daughter. And every time she sees my scars on my breast, she looks at me, she goes, "Mommy, you've got cancer. You're going to die, right?" It's the hardest conversation to look at her little face and to think, maybe that'll be her one day. So I'm not just doing this for me, my daughter, I'm doing this for all of you, and I really appreciate you coming out. And it is emotional. It is very difficult to go through chemo and to start a petition. And I applaud all of you who did sign the petition and who are standing up for the nurses today as taxpayers, as patients, as concerned citizens, because you don't want to look at your daughter's face and say, "Sorry, honey, I didn't stand up." Because I don't want to have to turn around and say to her, "I'm sorry, honey, I didn't do the right thing." I'm doing the right thing, and I'm thanking all of you for also doing the right thing. Thank you.
Arguably right now, we're already in a position where we're barely able to meet those basic requirements of providing capable, competent, and expedient care. Any further cuts in nurses, I believe, are going to take us below that level. I will announce immediately that my vote, and I only get one vote, just like all of you, but my vote will not go to a government that allows this healthcare system to deteriorate.
I know that I've heard concerns from the fourth-year nurses that it's really looking bad and grim for their job prospects. I've heard of a few who've been lucky to obtain positions in long-term care facilities, and a bunch of them haven't even gotten jobs yet. So it's very tough for all of them.
I want you to know that from my perspective, and obviously Khalil had already said it, that we're committed to a publicly funded healthcare system, not a two-tier system. One top-tier system. I actually think we have that now, and that's thanks to the people who are working within it. I always think we'll look to make it stronger. I always think we'll look to make it better. But I don't want it to slide backwards.
We've heard today's stories that are only the beginning of a healthcare crisis, of a system that will implode if these cuts continue. The only way to stop nursing cuts and program cuts is to lose our apathy and pressure our elected officials to stop the cuts. And as a closing remark, I'd like to quote my provincial president, Linda Haslam-Stroud, and say, "Let's never, never, never give up." Thank you so much.